Just a reminder that this is our final Wellness Wednesday for the year of 2023 outside of our Spanish programming EP Salud en Casa. So we'll be returning together in online live sessions on January 3rd with Empower Your Voice, enhancing cognitive and communication skills. It'll be a really nice and fun way to engage with each other in the new year. So I encourage you to join us to strengthen your voice and communication skills through this online program. You can learn more at parkinson.org/pdhealth. Tomorrow is also our final veterans webinar that we're hosting for the calendar year of 2023. Don't worry, there will be more in the coming year. If you're interested to learn about environmental exposures and veterans living with Parkinson's disease, you can tune in tomorrow at 4 p.m. Eastern Time, and you can sign up and register to get that Zoom link at parkinson.org/veterans. Want to thank our sponsor for today's webinar, Amneal. So appreciate you supporting the Parkinson's Foundation's mission. Thank you. I'll turn it over now to the Director of Strategic Initiatives of the Parkinson's Foundation, my colleague, Annie Brooks. Annie, thanks so much.
Thank you, Krista. It's so wonderful to be here with you all today. We are here to talk about hospitalization. People with Parkinson's disease have an increased risk of hospitalization and may face many challenges while they're in the hospital. In my initial years here at the Parkinson's Foundation, I spent a lot of my time visiting support groups, talking about our resources, and I was immediately struck by how common hospital horror stories were. So while you may have heard from friends or perhaps even experienced a challenging hospitalization yourself, the numbers are still striking. In a given year, 4 of every 12 people with Parkinson's will be hospitalized. Of those 4, 3 of them won't get the right medicine on time throughout their hospital stay. And of those 3, we estimate that 2 will have complications as a result. We are thrilled today to introduce you to the Parkinson's Foundation Hospital Safety Guide. Based on the Parkinson's Foundation hospital care recommendations, this guide is designed for people with Parkinson's disease and their care partners and loved ones to prepare for and navigate a hospital stay. This guide is designed to help you understand the risks people with Parkinson's face in the hospital, to prepare you to play an active role in the hospital before a crisis occurs, to help you organize care information to use in the hospital, whether it is a planned or an emergency visit, and finally to reference as step-by-step instructions in real time to have your Parkinson's needs met. The heart of this new guide is the 5 Parkinson's care needs, which align directly with the 5 care standards that we identified in our hospital care recommendations. These were adapted into plain language to be as specific and clear as possible, because if the person with Parkinson's and their loved ones aren't confident in expressing what is needed to the healthcare professionals that are caring for them in the hospital, even the best hospital staff will struggle to meet those needs. The guide outlines the same essential elements for each of the 5 needs, an explanation of why each need is important, the real-time steps a person with Parkinson's or their care partner can take to explain their need and ultimately have it met, an overview of some common challenges, and a quote from a real person with Parkinson's or care partner. Today, we'll be hearing from 5 Parkinson's Foundation ambassadors. They'll be walking you through each of these 5 Parkinson's care needs before we talk more about how you can be sure to prepare proactively long before you need to go to the hospital. First, we will hear from Richard.
I cannot start my video.
Thanks, Richard. We'll see what we can do. Ah, there you are.
Hello, everyone. My name is Richard Huckabee. I live in Ohio between Cleveland and Akron. and I was diagnosed with Parkinson's disease in 2013. I'm a Parkinson Foundation ambassador, a hospital care lead, a research advocate, PD mover, and a In Motion ambassador. I'm here to introduce to you Need 1 from the Hospital Safety Guide. And I want to be clear, Need 1 is I need my hospital chart to include my exact medication and reflect my at-home schedule. You see, this is very personal to me because shortly after I was diagnosed with Parkinson's disease, I found myself in the hospital for thyroid surgery. My doctor told me before I entered to make sure I take my medicine on time. So I get to the hospital, I'm in the waiting room, then they cart me into the hospital room. My wife is with me, the nurses are there, and I tell the nurse I need to take my medication on time. And I tell her, I have it right here. I have this kind of bottle, this kind of pill case. And the nurse tells me, no, you cannot take your medication like that. My wife starts to jump in and argue with her and tells her, no, my husband is going to take his medication on time. The nurse said, no, not in that. He cannot take any of those pills. So I tell my wife, let's not argue with the nurse. Let's just wait till we're by ourselves and we'll take it at the appropriate time. But since then, I've been educated and I know that had I brought my pill in the original bottle, like I will do now, this is my go bag, take it in the original bottle with my name, the prescription, and the times I need to take, I would have had a higher possibility of them accepting my medication. So this is very important because for us with PD, the hospital need to understand that we need to take our medication at specific times. We have spent time with our doctors coming up with the best time to take our medication, and we need to keep that routine in place. And as our Parkinson progresses, sometimes the routine will get more complicated. The medication we take may become more frequent. So we need to have this monitored correctly. Now, in the hospitals, there are some challenges to this because hospital pharmacies do not always carry our PD medication. They may not have your PD medication, or hospital medication schedules are standardized. They might have a 2-hour window or a 3-hour window when we want to take it within 15 minutes. So we need to follow these 3 important steps to help us stay on track in the hospital. When you go to the hospital, be prepared before you go. Have the forms that you need. You will see in this book, you will get a Parkinson care summary sheet. And you want to hand that sheet to everyone who comes in the room, to the nurse. Here's a Parkinson care summary sheet for you. The doctor comes in, tear it off, hand them a sheet. Here's a care sheet for you. Another person comes in. Here's a care sheet for you. Everybody gets a care sheet. You want to make sure they understand the importance of caring for you. Then you'll also have in your book a doctor's letter. Get your doctor to sign this letter because it states that your doctor gives you permission to take your medication during your hospital stay as long as it's in the original bottle. So get this signed off by your doctor. Then you'll have your medication forms. Fill out your medication forms because you might want to post your medication forms in the room so they know the exact times that you need your medication. And since you have your medication form, tell them you want to review your medication and timing on your chart. Have the doctor or the nurse print out a copy of your medical chart so that you can review it to make sure that your times for your medication is exact. I take my medication every time on time. I have my cell phone set to go off. An alarm will go off and tell me it's time to take my medication, and I'll pause whatever I'm doing and take my medication. So we want the same thing to happen in the hospital. So review that with your hospital care team. Tell them to print out your medical chart, so your medication chart, so that you can review it. And if they do not have your prescriptions at the hospital, remind them you have your go bag with the prescription and the original bottle, and I can offer this to you to administer to me, and usually they will because you have them in their original bottle. So follow these 3 steps, be prepared, and you will have a successful stay at the hospital along with the next steps that's coming up. Thank you.
Thank you so much, Richard. Next, we are going to hear from John.
Thank you, Annie. Good afternoon, everyone. My name is John Cox. I retired earlier this year after serving the public for more than 34 years as a paramedic firefighter. On Father's Day of 2017, I was diagnosed with young onset Parkinson's disease. I've been a Parkinson's Foundation ambassador since 2018, and I'm currently one of the hospital care leads for the New York, New Jersey chapter. Because of my geographic location, I live in the Hudson Valley of New York. I also assist the New England chapter as well. I'm also a vice president of our local support group here. So I'm quite involved with advocacy and education. So I'm going to be talking to you about need number 2. Need number 2, I need to take my Parkinson's medication within 15 minutes of my usual schedule. Next slide. Need number 2, of course, all of these needs, identified needs, are important, but to me, this is probably one of the most important, and I personally identify this as probably the most important. Why is that? There's a number of factors that play into that. Parkinson's symptoms, as we all know, can return in what we call a wearing off period. It's that period of time in between our medication dosages where we're no longer getting the medication and we're starting to see symptomology return. For many of us, our symptomology varies greatly, and our wearing off period, or our off time, varies even greater. Off time for many people looks different than your usual symptoms. For me, my off period presents it affects my speech. I start slurring my words. It affects my mentation, my cognition. I've even been told by some clinicians that if they didn't know that it was an off period for me, they would have thought that I was having a stroke. It can affect movement for some people. It can affect all sorts of things. Just like our symptomology varies from person to person, so does our off time. So with those changes, even the small changes in medication timing, it can lead to many different problems within the hospital settings. It can increase symptomology and worsen control. Even if we then get caught up in our time and our medications, that delay can throw you off. Again, for me personally, it throws me off hours, sometimes into the next day, if I've missed a dose or if I'm delayed significantly in taking a dose. It can impact the timing of your recovery overall. It can slow the recovery. Just because of the nature of our disease, it leads to an increase in falls. So if we're changing the timing of our medication, or we're not getting our medication on time, we are allowing the off periods to occur. That statistically has been found to increase the falls, which obviously we don't want. And thereby will also make it difficult to participate in rehabilitation. We don't need that. We go in already behind the 8 ball. So we need to stay on top of our medications, stay on top of our disease process, stay on top of our symptomology in order to shorten our hospital time as much as possible. Next slide. So our challenges for this, one of the biggest challenges that we all face with medication timing is that within a hospital setting, most nurses can give medications up to an hour before or an hour after the scheduled time. So in other words, if somebody is scheduled to receive their medication at 9 o'clock, they can receive it anywhere from 8 to 10 o'clock after. A 2-hour variance. And that can be huge for somebody with Parkinson's. Again, for me personally, and I speak for me personally just because everybody's so different, everybody varies. But for me personally, I know that I can feel when I'm getting near my time to take my next dose of medication. I can sometimes feel an off period coming because as we all know, off periods can occur randomly throughout our schedule. I can sometimes feel an off period building and starting and know that I need to take medication. So obviously a delay of an hour can really throw me off. If I take the medication too early and then the next dose is delayed, you can be talking a very lengthy process in between, and that can really wreak havoc with a person's hospital stay. Hospitals are busy places. Right? Taking your medication on time may get a little bit trickier in between things like other staff checking in on you. They're not going to interrupt if you're being evaluated by another service. If rehab services or rehab sessions are in progress, you're most likely not going to get your medication at that point, and they'll just delay it. If you're going down for diagnostic testing, the same thing, or surgical procedures obviously can really throw things off. So, and the other thing that comes to mind as well is hospitals are overcrowded and understaffed right now, and it's just the way it is in the field. So that becomes a huge challenge as well in making sure that our medications are delivered on time. Next slide. So some of the real-time steps that we can take in order to reduce issues with this and reduce the problems that may come from this. Explain the impact. Describe your symptoms and your symptomology and how not getting your medication on time affects you. Again, every person is different. All of our symptomology is different. Our symptomology in off periods presents differently. Offer reminders, offer general reminders, let the nursing staff know that it's almost time for your medication. An hour after you're supposed to receive your medication isn't the time to remind them. Remind them a little bit beforehand, and gentle reminders. Follow up, reconfirm your schedule with the nurse, and then share the documents that you see here that are included in the hospital safety guide, the Parkinson's care summary, the doctor's letter, and the medication form. For me, it's all about education and advocacy. Again, very often, unless we have specific experience with Parkinson's, even clinical staff are not aware of the variety of symptoms that are associated with Parkinson's and the different variations that can present. Again, hospitals are busy places. Hospitals right now, overcrowded and understaffed. So gentle reminders to the staff is often one of the best tools that we have. And the last bit of advice that I would offer is keep in mind shift changes and schedule changes within the hospital. That can greatly affect medication administration times. Often hospital schedules shift changes 7 to 3, they work 3 to 11 and 11 to 7. Some hospitals vary with 12-hour shifts. So I would offer this piece of advice. Check with the nurse when you first get into the hospital, find out what those shift changes are. Because very often you're going to have to go through these real-time steps and remind and re-educate and re-advocate for yourself each shift change until the full staff is fully aware of Parkinson's needs and they're able to follow through with that for us. Thank you.
Thank you so much, John. Next, we're going to hear from Kelly.
Hi, everyone. Kelly Tran, and with the Parkinson's Foundation, I am very proud to be their hospital care lead and also their ambassador for their South Central chapter. And when it comes to my involvement with the Parkinson's Foundation, I would say that my passion really started through the work that I do every day as a pharmacist. And so at my workplace, I had the opportunity to speak to a lot of patients that are diagnosed with Parkinson's, managing life with this complex disease. And then also these patients see a movement disorder specialists, which now brings me to need number 3. Next slide. This need states, I need to avoid medications that make my Parkinson's worse. These medications include those that block dopamine, sedatives, and certain pain medications. So now this brings the question, why is it important that I avoid certain medications? So we all know that when there is a lack of dopamine in the brain, we know that this is the primary cause of Parkinson movement symptoms. And so also Parkinson occurs when dopamine production is reduced. So when this happens, it can impact a lot of things like your coordination of movement, your speech, cognition, sleep, mood, and so much more. So when we look at dopamine blocking medications, so for example, antipsychotics like haloperidol and olanzapine, these medications can cause harmful symptoms and induce negative side effects. And also, other medications that you would commonly see prescribed in the hospital, be on the lookout because these medications can also increase that risk of confusion, sleepiness, and fall risk for patient. So now, as the patient, what I'm going to do is I'm going to take out my hospital care guide. And what I want you to do is when you go through the guide, I want you to go through the guide until you see the page that says Parkinson's Care Summary for Health Professionals. So, what I love so much about this resource is that it is very user friendly and it's only one page, front and back. So turning the page on the back side, you will see 2 columns. The first column shows the medications that are safe to use for patients with PD, and the second column shows medications to avoid for patients with PD. So going back to our example with haloperidol, I can see that, okay, on my care guide, that haloperidol is under the column of medications to avoid. So let's say if an antipsychotic is necessary, when I reference this summary care guide, I can easily determine that, hey, the only options that are considered safe for patients with PD are Nuplazid, Seroquel, and clozapine. Next slide. So now, what are some challenges that we can expect? There are some medications used in the hospital to treat nausea, confusion, and psychosis, which we all know as to be experiencing a hallucination, can worsen Parkinson's symptoms. And it is very possible that your hospital staff may not be familiar with safe PD medication alternatives. Next slide. So now I'm going to review the 3 next steps that will make life easier. So now step 1, I'm going to identify the harmful medications. So now going back to my copy of the care summary, I'm going to tear off a copy. I'm going to hand a copy to my nurse so she can share with the hospital care team. And then I'm going to keep a copy for myself so that I can have as a reference. And what I'm going to do is I'm going to point to the list of harmful medications, and I'm going to share this info with my hospital care team. Now, step 2, I'm going to review any possible interactions. So again, taking my guide, I'm going to make sure that, hey, anything that is newly prescribed to me at the hospital, I'm going to make sure that it doesn't fall under the column of medications to avoid. Another very important call out is pay very, very, very close attention to those medications prescribed to you before or after surgery, and also those prescribed for confusion and behavioral changes. And lastly, the last step, step 3, I will request for appropriate alternatives if needed. So let's say, for example, I noticed that my doctor prescribed me tramadol, which is used to treat my pain. So as a patient, what I'm going to do is I'm going to take out my guide and I'm going to let the nurse know, like, hey, I noticed that tramadol falls under the list of meds that are not appropriate for a person with PD. So the next step will be is I would then ask my nurse, hey, do you think it's possible for you to reach out to the doctor to possibly prescribe me something new that is a safe alternative to treat my pain? Now, as the patient, if you notice that you're getting the runaround and you start to have trouble getting a safe medication alternative, what I would then recommend to the patients is to reach out to a neurologist. And we all know that when it comes to managing your Parkinson's care, the person that knows you the best is your movement disorder specialist. So in a situation like this, definitely communicate your needs or concerns, and more than likely your doctor will be very happy to intervene to make sure that, hey, that you're prescribed an alternative that is considered safe for those living with PD. And that's all I have for me. Thank you, everyone.
Thank you so much, Kelly. Next, we'll hear from Heather.
Thank you, Annie. Hey, everyone. My name is Heather Lester. I'm an acute care physical therapist in Northwest Louisiana near Shreveport. I am LSBT Big certified, and I work with Parkinson's patients all the time. So I definitely see firsthand the importance of receiving medications on time and how that can impact movement. And that's what inspired me to become a Parkinson's Foundation ambassador. And then I'm a hospital care lead for the Gulf Coast chapter. Today, I'll be talking to you about need number 4. I need to move my body as safely and regularly as possible, ideally 3 times a day. So why is this important? It's important for everyone to stay active in the hospital because it helps you maintain your functional capabilities and recover faster. Some benefits for maintaining mobility are reduced muscle loss. It helps you sleep better, improved focus, better constipation management, and then it can also help prevent blood clots, pneumonia, bed sores, things like that. But not only is it important for everyone, it's especially important for people with Parkinson's, along with occupational and physical therapy, in order to control your Parkinson's symptoms, prevent falls, and minimize further complications in the hospital. So we know it's important, but there are some challenges to maintaining mobility while you're hospitalized. Sometimes your movement will be very limited to keep you safe, especially if you're weak after a surgery or there's complications managing low blood pressure or other issues that put you at risk for falling. So it may be that the staff really limits your mobility. And also you may require assistance to get out of bed, but sometimes nurses get busy and they don't have time for mobility, or the staff just may feel it's not safe for your family to help you mobilize. So these are the 3 real-time steps that we recommend to help you maintain your mobility while you're hospitalized. First of all, communicate your needs. Share the Parkinson's care summary and the doctor's letter that are in the hospital safety guide. Point out that you need to move to manage your Parkinson's symptoms, and describe your typical physical activity and ask for safe alternatives. Because many times if the nurses or nursing staff understand and know that you normally ambulate, you normally get out of bed safely, then they're more comfortable allowing you to continue your normal activities. So if safe, you want to continue the activities you did at home. And if you can't get up, you may still be able to exercise in the bed or in a chair. And finally, if you're having difficulty getting out of bed and mobilizing, you want to ask for a therapy consult if you need help moving safely. Thank you.
Thank you so much, Heather. Next, we are going to hear from Mary.
Hello, everybody. I can't seem to get my video going, but I'm Mary Ochoa. I'm a speech language pathologist at the Waverly Health Center in Waverly, Iowa, where I work with hospital inpatients and outpatients. I've worked with people with Parkinson's throughout my career, and have been certified in the LSVT Loud program for the past 20 years. I'm also a Parkinson support group leader, and I became a Parkinson's Foundation ambassador last year. About 10 years ago, Parkinson's became personal when my father was diagnosed with the disease. So as a speech language pathologist, or an SLP for short, a big part of my job is working with swallowing disorders. So today I'm going to be discussing need 5. I need to be screened for swallowing changes to safely maintain my medication routine and minimize my risk of aspiration pneumonia and weight loss. So why is this important? Difficulty swallowing is known as dysphagia, which is common in Parkinson's disease and can cause problems with eating and drinking and taking pills. This can in turn result in weight loss, dehydration, and poor control of Parkinson's symptoms. Dysphagia can also lead to choking or aspiration pneumonia. Aspiration is the term that we use when food or liquid enters the airway and passes into the windpipe. That material can settle into the lungs and in certain circumstances may lead to aspiration pneumonia, which is a common cause of death for people with Parkinson's. A bedside swallow screening and therapy with a speech language pathologist can help identify swallowing issues early before bigger problems arise. SLPs can provide safety measures to decrease aspiration and to decrease the risk of complications due to swallowing difficulties. Some challenges are that people with Parkinson's may not know they have swallowing issues. Aspiration can happen silently, not always triggering a cough response. Or things like coughing or needing extra swallows might be mild and not recognized as signs of dysphagia. Then when someone is ill, those minor swallowing issues can worsen and create severe complications in the hospital. A swallowing screening and an evaluation by a speech language pathologist can help identify dysphagia, but this is rarely ordered unless the patient is showing very obvious signs of swallowing difficulty. Another challenge is, in order to decrease the risk of harm from dysphagia, staff may order NPO, meaning nothing by mouth. This may include no medications, which obviously can worsen your PD symptoms, and pre-existing swallowing issues may then get worse. Staff may not realize the detrimental effects that being NPO can have. So what can you do? First, tell staff if you've had problems with swallowing in the past, and ask for the speech language pathologist consultation. They can provide education about swallowing and helpful strategies, or they may recommend further testing of your swallowing. 2, avoid medication pauses. Discuss safe ways to continue taking medications with your nurse. There may be alternative ways of giving medications that could work for you. And 3, you can decrease your risk of aspiration pneumonia by sitting up for meals and eating when your Parkinson's meds are working. Take smaller bites and sips and don't eat fast. And also brush your teeth, tongue, and mouth before and after eating to reduce oral bacteria that could be aspirated. Unfortunately, oral care can often be overlooked in the hospital, but it's one of the simplest and most important things you can do to reduce your risk of developing aspiration pneumonia.
Thank you so much, Mary. Together, these 5 needs are meant to give you, whether you live with Parkinson's or you love someone with Parkinson's, the language that you need to explain how to best manage Parkinson's disease while in the hospital. These needs are each their own challenge, but they're interconnected. In order to be able to give your medication on time, it has to be ordered correctly. If you aren't getting the right medications, it can impact your ability to move and swallow. We often see one problem lead to another in the hospital, and through a domino effect, a small decision made by a well-meaning healthcare professional can cause big negative consequences. You can think of this as the symptom spiral. One thing goes wrong, which leads to another and another, and as symptoms get worse, the person with Parkinson's is at higher and higher risk for falls, swallowing changes, muscle deterioration, medication side effects, mental and physical decline, and even decreased independence. We want you to be educated on what can go wrong and prepared to explain how to avoid these missteps. Being here today is a great first step. And now I'm going to walk you through some of the next steps that you can take to be prepared ahead of an emergency. The first thing you can do is make sure that you've ordered your own copy of the Hospital Safety Guide. These ship for free throughout the United States. And if you're joining us from outside of the United States, you can download and print them from home. They're each in the format of 8.5 by 11 pages, so they should be very easy to print. And let us know now on the poll if you've been able to order or download your copy. Give it a minute. To order, you can go directly to parkinson.org/store. Or if you want to take a look and download before you put in an order, you can do that at parkinson.org/hospital safety. All right, thank you guys. So once you've printed or received your guide, you should remove the medical alert card. One of these should be given to the person with Parkinson's to keep in their wallet. The second copy can either be kept in the guide or can be removed for a care partner to keep on hand. Your next step is to create your hospital go bag. Those of you who have an old wear and care kit can use the little black bag for this, though it may be helpful to choose a bigger bag that's big enough to keep your guide along with all of your forms, medications, and any device-specific tools you may need. Whatever bag you choose, you should always keep at least 2 days of your Parkinson's medication in their original bottles from the pharmacy. This is incredibly important because the majority of hospitals will not let you use your own medicine if it is not properly labeled. And having your exact medication with you is one of the best ways to ensure that you can get the exact right medication without substitution. You'll want to identify at least one hospital care partner who is committed to accompanying you to the hospital and advocating for your needs. And you should work together with this care partner or many care partners to complete the necessary forms that are provided within the Hospital Safety Guide. I want to really emphasize just how important it is to have a plan to make sure that someone is with you in the hospital in the event of an emergency. Unfortunately, you cannot count on yourself being able to communicate as well as usual when a hospitalization occurs. And as you've seen today, there's a lot to communicate to hospital staff who may not know all that much about Parkinson's. Please don't wait for an emergency. Identify someone that you trust and prepare with them so that you both feel confident and ready to take on every challenge that may come up in an emergency hospital visit. Your medication form should be updated every time your medication routine changes. We've included in the guide a sample medication form where you'll see some things you might not have thought to include. Always include specifics about how and when you take your medications. Use the notes section to point out any medications that need to be taken together. Remember to include medications that are used as needed, including anything that you use to manage constipation. And don't forget over-the-counter medications. These are so important to include on the list as well. The doctor's letter is an incredible tool built into the hospital safety guide. But to maximize its impact, you need your Parkinson's doctor to sign it. We then recommend that you attach a copy of your medication form to the letter. So think about the easiest way to get a signature from your doctor, whether you want to email it or send it digitally for them to sign and send back to you, or if there's an upcoming appointment on your calendar already that you can bring it with you. And don't forget to attach that medication form. And there's no action needed for the Parkinson's care summary until you're in the hospital. But then, as Richard said, you'll want to hand these out to everyone as they are providing care. You get a care summary and you get a care summary. Make sure everyone really understands what you need. And this is a great resource to ensure that they do. So remember, this guide is designed for people with Parkinson's and their care partners and loved ones to be prepared for and to navigate a hospital stay. Review it early and often so that you understand the risks that people with Parkinson's can face in the hospital, so that you are prepared to play an active role in the hospital long before a crisis occurs, so that your care information is organized to use in the hospital, whether it's a planned visit or an emergency visit. And remember to reference the guide as a step-by-step instruction manual in real time in the hospital to get your Parkinson's care needs met. And with that, I will turn it back over to Krista.
Thanks, Annie, and just so grateful for the amount of work and input and feedback that you put and intention, right, behind the hospital safety guide. Just want to cover, for some of us who have an Aware and Care kit, would you recommend that they also get a hospital safety guide?
Yes, we absolutely do. This guide features new and vital information that wasn't included in the Aware and Care Hospital Safety Kit previously. And so we recommend that even if you have, an old kit, that you either order a hospital safety guide or at a minimum, review the guide online and print all of the guide resources to add to your kit. If you've got the kit bag, you can use that as a place to keep your current medications. Though, as I said, you may decide that having a single bag that fits the 8.5 by 11 guide in it is a better fit for you.
Yeah, I'm curious how you did design this guide. How was the hospital safety guide created?
So this was a labor of love done in close collaboration with a really broad-reaching and diverse committee. We engaged our People with Parkinson's Advisory Council, or PPAC, which is made up with people with Parkinson's and care partners, as well as a handful of other Parkinson's community members who have been trained as Parkinson's Foundation ambassadors, many of whom have had their own really challenging hospital experiences. We also worked closely with staff members across the foundation, including members of the Parkinson's Foundation Helpline. And we partnered with health professionals, both those who are experts in Parkinson's care and those who provide care in the hospital setting, so that we were designing something that was not just useful for the person with Parkinson's and the care partner, but something that would be effective and useful for the hospital nurses or the hospital social worker or the hospital physical therapist or speech language pathologist as a reference tool as well. So we really tried to take every perspective we could and ensure that we were creating something that was truly a tool that allows folks to get what they need and to do so with confidence and without having to feel that it's such a heavy burden.
Yeah. Thank you for the amount of effort and energy and considerations that, you know, the team and our councils and the committee put into creating a guide to support and advocate those of us living with Parkinson's in the hospital. Appreciate it immensely, Annie. Really.
Yeah, and you know, at the foundation, this is really just one strategy that we are taking to solving this problem. We recognize that asking people with Parkinson's and their care partners to be experts in the care that they need is not a great long-term solution. We want to solve this problem as a systems problem, and so we are working with healthcare providers as well as hospital systems to try to change how hospitals provide care to people with Parkinson's and prevent harm before it occurs. But this is sort of the long strategy. It's going to take us some time, and we've got to keep our heads down and keep plowing forward to make hospitals across the board safer for people with Parkinson's. And so until we've met that goal, the hospital safety guide really is an excellent tool for you to have that we hope you won't need. You know, we always hope that a hospital visit won't be necessary, but statistically speaking, if you have Parkinson's, you're going to find your way into the hospital eventually. And so we want to make sure you're prepared. It may not be related to your Parkinson's. You know, you could find yourself getting into a car accident. So many people have, you know, heart incidents that bring them to the hospital, or even an infection. There's so many things that can go wrong for any of us at any point in time. And so as scary as it is to think about it, you'll have a much better time in the hospital if you've thought about it ahead of time and you have a plan.
Yeah, thanks, Annie. A question that just came through. They're sharing that many doctors don't know about the drug interactions nor the hospitals, and that they've had their carbidopa-levodopa filled at 2 different pharmacies. Both of the labels mention take with food or without. And then they write, is there a way you could inform them? And I imagine it's informing them about the hospital guide or the drug interactions. Could you speak to that?
Yeah, absolutely. You know, it's a great point that your regular pharmacist can be a really excellent partner in your care as well. And so, you know, whether you're going to, you know, a big chain for your Parkinson's medication, or if you're, you know, going to your local mom and pop pharmacy, bringing the guide with you and talking to them about what you need is always a positive thing. And this is the same with your regular Parkinson's doctor. We often talk about how important it is to have expert Parkinson's care, to see a movement disorder specialist or a general neurologist, but we also know that that's not a reality for everyone living with Parkinson's. We recently published data that found less than 10% of people with Parkinson's have access to a movement disorder specialist, that sort of top level expert in Parkinson's care. And so, you know, if you're seeing a general neurologist or you're seeing a primary care provider, to treat your Parkinson's, they may not be as connected to the Parkinson's world as we would like. And so you, as their patient with Parkinson's, can really help educate them, which again seems like a bit of a heavy load, but it's something you can do to give back to the Parkinson's community around you. Bring your hospital guide with you, share it with them, encourage them to reach out to the foundation. They can get a copy to share with other Parkinson's patients of theirs, and they can order, resource order forms and help make sure that, even if they only have 2 or 3 Parkinson's patients that they see, that they're sharing these important resources with them, and that they know that they can come to the Parkinson's Foundation for support, resources, and information in the same way that you can.
I got a question from one of our viewers, Marty, who's asking how can we assist with changing the culture and processes and procedures. Wondering, Annie, if you can share how they can be involved in this initiative within the Parkinson's Foundation.
Yes, absolutely. So today you heard from 5 Parkinson's Foundation ambassadors. That means they're volunteers with us who have gone through a certain level of training and can do different tasks out in their community on behalf of the foundation. And we are about to roll out the first round of advanced training for Parkinson's Foundation ambassadors focused on hospital care. This first advanced training will be focused on sharing it with the Parkinson's community. So going out and speaking to people with Parkinson's and care partners in support groups or exercise classes, or at in-person or virtual gatherings of people with Parkinson's, not unlike this PD Health at Home program. However, in the future, we're hopeful that we will be able to provide additional trainings that help us bring more volunteers into the processes. We are working hand in hand with hospitals and health systems. And as you go through the trainings and start working in your local communities, you're likely to make connections that can help us at the foundation have these conversations. And so if this is something that you're passionate about and you're not already involved as a Parkinson's Foundation ambassador, we really recommend that you take a look at our volunteer program, take a look at the trainings we offer and the support provided by our volunteer team, and share what you're most excited about. And if that's hospital safety, that's something that we want to bring you along for and utilize your talents and your time and your enthusiasm. There's so much work to be done, and we absolutely would love for you to come alongside us as we work to make hospitals safer for people with Parkinson's.
Thanks, Annie. In our last few minutes together, I would like to invite Richard and John to come back on if they're still hanging out with us, 2 Parkinson's Foundation ambassadors who you heard from today. And as we close the webinar, just want to hear from you guys one more time if you have any words or sentiments or things to share as we round up our conversation about hospital safety for people living with Parkinson's. John or Richard, anyone want to share?
Well, I would just like to leave everybody with, it's important to be your own advocate, to be your own healthcare advocate, and know that we're all in this together and there's always hope.
Yeah, I would echo that. A big part of living with Parkinson's on a day-to-day basis is education, educating ourselves about it and educating those around us. And that makes our days easier and better. It makes our future better. So for me, education and advocacy plays a big part in my day-to-day role. This is a huge tool in our toolbox, and I'm really looking forward to rolling this out, being able to utilize it myself, and being able to distribute it to those around me that I assist with this.
Thank you, Richard. Thank you, John, for sharing those words. And Annie, any final thoughts or feelings, impressions before we close out today's webinar?
I'll just express my gratitude to those of you who joined us today, to our wonderful Parkinson's Foundation ambassadors who presented, and those who didn't, who are really helping us move the needle. Whether they are going out and speaking in their local community to people with Parkinson's, or standing by our side as we're doing research or working actively on interventions with our partners in healthcare. This is not something that one person can solve. So keep in mind that you, as a person with Parkinson's receiving care in the hospital, aren't going to solve this problem, but that together we do have hope. Together, we do have the power to change how care is provided. And I'm confident that we are on the right path, and that this is something as a priority for the Parkinson's Foundation that we'll see significantly change in the coming years, which I hope you all feel excited about, like I do.
Great. Thank you, Annie, John, Richard, Heather, Kelly, and Mary, for your thoughts, your significant impact on building the safety guide, and for everyone who's present today to learn more on how you can advocate for yourself in the hospital. Really admire you're already taking that first step in advocating for yourself and for your loved one living with Parkinson's. I'd like to thank our sponsor for today's webinar, Amneal, for supporting the mission of the Parkinson's Foundation and for making webinars like today's possible. If you have any questions during the webinar that we weren't able to answer, if you're looking to get connected to a local Parkinson's Foundation representative, and how you can be engaged in bringing strength to the hospital initiative that the Parkinson's Foundation is so deeply behind, you can reach out to our helpline. We'll get you connected to a local representative. You can also browse our website at parkinson.org or email us at helpline@parkinson.org. And just before you go, please let us know as you close the Zoom screen. A survey will pop up. We take our feedback very seriously and pride ourselves on what we have to offer and how we spend our resources supporting people living with Parkinson's today. So please let us know how we did and what you would like to hear in the future. Until then, be well, everyone. Happy holidays. And I hope I'll see you in the new year.